Health information is everywhere. It's confusing. We're sitting down with doctors to help make sense of it.
Take me to Krause.
Take me to Krause.
Take me to Krause. They saved my life.
Welcome to the podcast studio at Krause. Today we're talking about one of the most stressful jobs at any hospital. Fast-paced, unpredictable, relentless. I'm talking about the ER. Emergency room doctors have the highest burnout rate of all physicians. With that said, our guest today has been working in the Krause ER for 9 years, and there's no place he'd rather be. Welcome to the podcast, Dr. Kevin Stimpson.
Thanks, Gary. Glad to be here.
So with all of that, the stress and the hours and the trauma, what is it that you love about emergency medicine?
I love the team atmosphere. I love the patients. I love the unpredictability. There's never a dull moment.
There are times when you're taking care of, 10 patients at once?
Yeah.
Yeah. You have to keep all that straight in your head.
Yeah.
Were you always good at that, sort of multitasking, or is it ADHD?
It's probably more the latter.
Really?
I'm good at having a lot of things going on at once, probably less good at finishing a lot of things at once, which is probably why I was drawn to ER, because I can stabilize folks and then they can be treated more definitively by a specialist.
Mm-hmm. Well, Krause's ER is known for having the shortest wait times. We see the ads, and it is the case. I don't know about every single day, but in general. So the question I have to ask is, how do you do it?
The way that we're able to reduce the wait time is something called the provider and triage process. So what that means is when someone walks in, they're registered quickly, and then they're ideally immediately brought back to a triage room. But you're not seeing just a technician or a nurse. There's actually a physician there who sees you very briefly, identifies any immediate life or limb threats, and gets orders started, IV fluids, meds, labs, imaging, and then they're moved to an internal waiting room until an exam spot opens up. And then, so if I'm the provider in triage, one of my colleagues will pick that patient up and perform a more thorough examination. But at least this way, instead of waiting out in the waiting room with no one seeing you, at least the labs are in process, X-ray can take you for imaging, we can get meds started, and we can identify, most importantly, folks who have that time-sensitive illness.
Right. That real emergency, which is what the emergency room is for.
Yes.
So, and we'll get to that in just a few minutes, but I do have to ask you, do you watch The Pit?
I don't watch The Pit, and you're not the first person to ask me that. I'm told that I resemble Noah Wyle. I've never seen the show, but I do enough ER at work that I don't need to watch it at home, too.
Right. Well, let me just fill you in a little bit. And really, what a lot of people in the medical profession say, it's pretty realistic. It's gory. You know, I watch it like this, and I ask my husband, can I look yet? And most of the time he'll say, not yet, not yet. But what I think is really interesting for people is it is a look at some of the non-health issues that you deal with the emergency room. I mean, they've had episodes about assault against healthcare workers. They had one where ICE agents brought in a patient. And also they dealt with the incredible financial stress on people. This one guy who was a severe diabetic, he left the emergency room because he was afraid of the bills that would come. Talk about what you see in terms of the social issues along with all the health issues.
Sure. So literally everything you just said, with the exception of ICE and ER, I see probably literally every single shift.
Every single shift?
Yep.
Assault on healthcare workers?
Absolutely.
You're kidding.
Yep.
Anybody ever hit you?
So I've been hit, not terribly so, but one of my co-residents was put in the hospital with multiple facial fractures from being assaulted by a patient. But I've been punched, I've been kicked, and probably 2 weeks ago, I was probably just about to get hit, and one of my friends, one of my colleagues, Justin, who's a big burly tech, he went whoop and stepped right between me and the patient, and it stinks, but doesn't mean it doesn't happen.
Yeah, and yet you still love emergency medicine and what you do. Can you talk about the kind of temperament you have to do what you do?
You have to have an even keel. You have to be a stabilizing force to the ER, because everything else about it is just chaotic.
Yeah, I mean, you are seeing patients in their worst moments.
Yeah.
What's the craziest thing that ever happened in the Krause emergency room to you?
To me, in the Krause ER is a tragic story. But there was a trauma shooting victim who was dropped off in the ambulance bay. He was talking when he got here, and in front of me, he died. And one of the shots was to the chest, and an indication to open someone's chest is if they lose vital signs, if they die in front of you, and try to find essentially a hole in their heart and try to fix it. I opened his chest, I held his heart in my hands, and I felt the blood just drain from his heart. I'll never forget it. It was
How long ago was that?
a couple years. Yeah, it was awful. But at the same time, that's what we train for. I wish the end result was better. But that's part of what our job is as ER physicians.
Well, let's talk about the sort of day-to-day of what you see in the ER. I think people freak out about the idea of going to the emergency room. Can you give us some guidance on when you need to go to the emergency room and when maybe it's something you should go to urgent care or just call your doctor?
In general, if you're concerned at all, go to the ER. The worst that'll happen is say, you know what, I don't think this is an emergency. I think you're just able to follow up as an outpatient.
Right.
So if you're concerned, we're always here. And I can tell you, no matter how minor the complaint, we've always seen less minor. But at the same time, we can certainly handle sore throats. We can handle rolled ankles. And what if that rolled ankle is a broken bone that may need surgery?
Give us some of the sort of symptoms that are definitely ER material.
Chest pain, shortness of breath, altered mental status, if you have numbness, tingling, weakness anywhere, terrible headaches, someone's not acting right, all definite ER material.
What about the ambulance versus have somebody drive you versus, oh, I'm just going to drive myself to the hospital? I mean, I've heard that before. People say, well, I was having chest pain, so I got in the car.
Great question. And the answer is, it depends. You can certainly say, if you have chest pain, you'll never go wrong with calling an ambulance. If you're short of breath, you'll never go wrong with calling an ambulance. Certainly, if there's one part of your body that's not working, you'll never go wrong with calling an ambulance.
Maybe a stroke.
Exactly.
Yeah, exactly. So if you could change something about the way the world is working right now as it relates to emergency medical care, what would you fix?
We may have physical space to treat folks, but if we don't have the staff to care for you, it doesn't matter. It's like if you walk into a restaurant and there's 25 open tables, but one waiter, you can sit at a table, you're not getting any food.
Right.
So if we could multiply our staffing, I think that would go a long way to solve a lot of problems in healthcare. And the other thing isn't a healthcare thing, and that's going back to respect. If you treat other folks with respect and with kindness, I think a lot of the issues of the world, including healthcare, they just go away.
Yeah. How do you keep your cool when somebody is mouthing off to you in the emergency room and you are just there? You might be at the end of your shift and you are just trying to help them.
Yeah.
Like, how do you do that?
At times it's difficult. In fact, the other day it was a situation. I was myself and the staff was getting yelled at, and I felt my temperature rising, and you have to be cognizant that you are the provider, you're the professional, and as soon as I feel it, I say, all right, I don't think this conversation is productive. I'll be back in a few minutes. And I think that gives all parties a chance to cool off.
Right. You actually say that with the patient
Oh, absolutely.
there.
Yep.
Yeah.
Yeah. And so I did. I went back to my computer, did a little charting,
Yes.
came back, and I said, let's start over. I shook the person's hand. I said, I'm Dr. Stimson.
Yeah.
How can I help you today? And after that, it was like nice. It was
Yeah.
like night and day. But it's difficult.
Yeah.
But you do have to be the bigger person and be the professional, because that's why you're there. And you're absolutely right. And try to remember that you're seeing folks on what may be the worst day of their life.
Well, thank you so much for your time today. You going to work in the ER?
No, I'm actually off today. I finished a stretch, but I don't really know what else I'm supposed to wear.
It looks good on you, Dr. Stimson.
Thank you.
Thanks so much for being here.
Sure.
We really appreciate you.
Absolutely. Thank you for having me.
And thank you for being here, for taking the time to invest in your health. Informed patients make stronger decisions, and that starts with information you can trust from people who actually provide health care in our community. That's why we do this. I'm Carrie Lazarus. We'll see you next time on Take Me to Krause.
For more information on what you're hearing on this podcast, go to krause.org/carry. The information in this podcast is not intended as medical advice. It's always best to check with your doctor.